Hello, everyone. I'm Dr. Mark L. Gordon with the Millennium Health Centers, where our focus is on neurorestorative health, restoring brain and body function after trauma. We work with individuals whose injuries or exposures have led to changes in personality, mood, emotion, and cognition. By addressing the underlying biochemical and hormonal imbalances that drive these changes, we help people recover their sense of self, restore resilience, and regain quality of life. I'm sitting here with nearly 90 impressive questions you've sent in, and in this installment of Gordon Live, supported by the Millennium Health Centers, I'll be answering some, if not all, of the questions that have been asked. Many of you questions overlap, so I'll do my best to answer them in grouped responses. For those who want to dive deeper, visit my educational website at tbihelpnow.org and look under the section Science. You'll find many of the papers I've written for both clients and colleagues who follow our work. We also have a YouTube channel with video testimonials, lectures, and past discussions, including my key COVID conversation with Joe Rogan in episode number 1589. Now let's get to your questions. A global answer to many of the questions about TBI, concussion, repetitive head injury, subconcussive trauma, long COVID, Parkinson's, Alzheimer's, CTE, multiple sclerosis, and even tinnitus is this. All of these conditions share one common driver: chronic inflammation in the brain. Infections, gut dysbiosis, certain medications, surgeries, chronic stress, and even aging can all trigger the release of inflammatory chemicals called cytokines. These cytokines disrupt the brain's ability to produce its own protective steroid hormones known as neurosteroids, and interferes with neurotransmitters like dopamine, melatonin, and norepinephrine that regulate mood, cognition, and resilience. When the gut becomes inflamed, whether from COVID infection, vaccines, alcohol, or certain drugs, you can also lose much of the serotonin produced there. Since 90 to 95% of serotonin is made in the gut, losing this supply leaves only the small fraction produced in the brain, further increasing the risk of depression and cognitive decline. So if inflammation is the fundamental cause of this biochemical disruption in the brain, why aren't we addressing the cause directly? Part of the reason is that if we truly succeed in reducing and stopping inflammation, the individual is potentially healed and no longer requires ongoing treatment, only preventative care moving forward. The other part is systemic. Healthcare providers have largely been trained to treat symptoms, not root causes. I have a few people who have written in and stated that they went into the Millennium and started the Millennium Phase 2 protocol and had improvement in their emotional state and ringing in their ears called tinnitus, and reduction of brain fog and other symptoms with their physical trauma. We have over 12,000 clients who are presently experiencing a variety of benefits from this protocol. I will admit that not everyone has achieved their optimal goal from this treatment protocol. And what that tells us is that there is more that needs to be done, like running a 28-point biomarker panel. This is a blood test that looks at the disruption in hormonal production in the brain and below the neck. These are the neurosteroids and the neuroactive steroids that regulate our body. The lab panel provides us with a roadmap of how to treat each patient in terms of hormones and anti-inflammatory products. Our treatment programs are not designed to be lifelong, but to correct the issues and to stop or reduce the program as indicated by your symptoms. Some have asked about psychedelics for treating addictions, psychiatric conditions, and post-TBI. In regard to psychedelic-assisted therapy, the Millennium's first goes after correcting their hormonal imbalance, the neuroendocrine system, concurrent to reducing inflammation. Once this is done, we rarely need to refer patients out for psychedelic-assisted therapy. Nonetheless, I do work with a number of centers outside the United States with ibogaine, psilocybin, and ayahuasca. I think these are impressive treatment modalities for those people who have had their hormones corrected but still have issues. Anyone thinking of having a psychedelic-assisted therapy, I refer you to our website under the science and read my paper neuroinflammation as a barrier to the success of psychedelic-assisted therapies. What has been reported to us is that our patients who have had their neuroendocrine system return towards normal have done better with their psychedelic experience. For those of you in healthcare that want to get the training, please go to the millenniumhealthstore.com and order the 7 lecture series. Use the discount code NEWTBI Network for a 30% discount. There's a lot more I can go through, but I will have time for other short videos in the future. Thank you very much, and please remember to look at the science that's available at tbihelpnow.org. Thank you very much. Bye-bye.